Well, since I'm 10 years of age, I always wanted to work with something around animals. And then I was living with a horse at home, and I decided to be a large animal vet one day. So the veterinary world is well aware of the antibiotic resistance, and there have been changes now in the normal practice of everyone. Antibiotic resistance is not just a human problem or animal problem. I think it's a One Health concept, so even a global health concept. So if we take care of that in human, it should be in veterinary medicine also, but not only in Europe, all everywhere in the world. So it's a big challenge, but we need to start somewhere. And we know that in all cases, in all type of wounds, closed or open, we have contamination. We are quite blind on what kind of bacteria is present. So we need to act first immediately, so with a product that is broad spectrum. And so when you remove the dressing, you should be first sure that you don't leave anything inside from the product. But also when the product is in contact with the wound, to be sure that the different cytokine, the cells are not, that there is no interference with them. A very important thing also is to always try to leave the body react by himself in the healing process, and let the macrophage, let the neutrophil do their work and not interfere with them. We are not looking for a sterile wound. We are looking for a wound that heals, where you have the smallest scar as possible and the less complication as possible. And if we want to try a new wound dressing, we hope that it will increase the wound healing. It will shorten the recovery time, and at the end, it should also reduce the cost for the owner. Veterinarians are waiting for new innovation in the wound healing. First, because traumatology and surgery is a very important part of the work of a vet. Most of the cases nowadays, we are not satisfied with the answer. And my advice would be for every vet to consider a new product first, if he understands properly all the wound healing phase and the wound healing process. And I think in all the new technologies that we have now, I think that probably antimicrobial peptide is one of the fields that needs to be considered in animals and in horses. And I think in the future it should be possible to treat wounds without any antibiotics.